So the key is that a transplant means the bad or diseased non-functional liver is taken out and a new liver put in its place. My name is Professor Dr. Tom Cherian. I am a liver transplant surgeon. I am part of South Asian Liver Institute, and South Asian Liver Institute and WOCAT is now coming together to provide a state-of-the-art liver care facility in Mumbai. So what I want to discuss today is something that is important for each and every one of us. And why is it important? Because it is so common. Approximately 30% of India is said to have fatty liver disease after the age of 40. If that is true, then almost every one of us has got somebody in our family who's got fatty liver disease. And many people think fatty liver disease is common, everybody has it, it's nothing to worry about. I must say, if I look at the last 1 year of treatment and transplants, approximately 30% of our transplants has been for fatty liver disease. And therefore, if 30% of transplants are fatty liver disease, obviously it is something that can lead to serious liver disease, and the key is prevention. Prevention is simply weight loss if you're overweight, medications if you're having uncontrolled sugars, in other words diabetes, and sometimes that might mean having insulin. Having insulin is definitely better than having cirrhosis. Therefore, weight loss, which is healthy diet, exercise, sugar control, and that will try to bring down the fatty liver back to normal. One amazing fact that I will leave with you is that the liver has got great regenerative capacity. That means even if it is injured, if you allow it a chance to recover, it will recover. It can recover better than almost any other organ in the body. And therefore, my plea to all of you is don't ignore fatty liver disease. Aim to bring your liver back to normal while it still can. Once it reaches a late stage, it is difficult to bring it back, because once cirrhosis has set in, that reversibility is no longer present. So my suggestion is that if any of you think you do have fatty liver disease, take these precautions. We are always here in WOCAT hospitals at South Bombay, and so if you want an opinion, please feel free to come in and we can guide you with treatment that is specific to you. Today, there is an important question that is part of everybody's mind as to when do we need a liver transplant? When is it indicated? Does anybody with liver disease need transplantation? Well, the key is we transplant surgeons and transplant professionals know that there is a risk of life with transplantation. We also know that it is a very expensive operation. So we use transplantation as our last resort. In other words, if the risk of death is greater without a transplant compared to with a transplant, that is when indication for transplantation becomes possible. So in fact, in most cases, the patients that I operate on or I have done for the last 1 year, they have an approximately 80 to 90% risk of death in the next 12 to 14 months. And with the transplantation, I convert the risk to about 10 to 15%. So I bring it down by about 10%, 10 times, and that is the purpose of a liver transplant. It saves lives. Many people ask me, what is a cadaver transplant and what is a living donor transplant? So the key is that a transplant means the bad or diseased non-functional liver is taken out and a new liver put in its place. Unlike kidney transplants, we all have only one liver, and therefore it is always a dilemma as to how we achieve that. One source is what is known as cadaveric liver transplant. So people who had brainstem death due to, let's say, a road traffic accident. So the brain is dead and they're actually dead and they're being kept alive only because of ventilators. These patients, we take out the liver, and that is called cadaveric donation. So the family member is not involved, and then they get put onto a waiting list, and by strict rotation it is allocated to the right patient. A living donor transplant, on the other hand, is because there is a waiting list for cadaver transplants, there is sometimes not enough time for the patient to wait until a cadaver transplant becomes available. In such situations, family members come forward and we take out part of the family member's normal liver, approximately 60%, sometimes even 65%, and we put it into the recipient or the patient who needs the transplant. This is called a living donor transplant, and the liver regenerates in size back to almost 90-95% of its normal size within about 6 weeks. This is the wonder of creation. I hope this has explained this complex situation. One of the things that always hurts me and makes me feel a little bit bad is the sheer amount of money that you need for good quality liver treatment. So a liver transplant is expensive and outside the boundary of average people in India is what I always worry about. But after having done nearly 300 transplants in India now, I feel that not doing a transplant is not cheap either. Let me give you an example. About a year ago, I transplanted a young child who was only 11 months old. That child had been admitted in approximately 4 to 5 different hospitals for about a week each time, in ICU sometimes. And each time the bill of the hospital for the father was about 2 to 3 lakhs. So if you count it all, he had spent more than 13 to 14 lakhs within those 11 months that the child had been alive. And at the end of that, the child without a transplant would have died. So my point is, liver transplant or liver surgery is required when there is no other option. But when it is required, it is cheaper to have a transplant done rather than have 7 admissions, each time getting worse and worse, and each time getting sicker and sicker, and then finally having a poor outcome after having spent the 20 lakhs. It seems to me to make sense that you spend that money, unfortunately, if you do have the liver disease, but spend it wisely so that you have a patient who is alive at the end of it and who can lead a normal life. Most of my patients are back at work, earning their own livelihood, and after a transplant, and just like blood pressure, they have 1 tablet in the morning and evening, and that is all. It doesn't mean that you cannot work. Most of them are back at active work. I hope this is a sensitive topic. I hope this brings some clarity into the costing of transplantation.